Hi, I'm Craig Davis with AARP Oklahoma, here again with Dusty Darr, and we're going to give you a brief update on what's been happening this week at the state capitol and the legislative session. Busy week, Dusty.
Another busy week, Craig.
What do we have going as our top priority? I know House Bill 2566 by Representative Wright.
That's right, Craig. House Bill 2566 by Representative Harold Wright, a Republican from Weatherford, passed the House overwhelmingly about 2 weeks ago on a vote of 88-6, and that bill is now over in the Senate just awaiting to be heard on the floor. We feel like that is a very important bill for our members and for the state. The bill would basically allow residents of assisted living facilities to continue to freely choose the pharmacy of their choice, the doctor of their choice, without facing any penalties from their providers.
And we had a chance to visit with Representative Wright this week about the bill, so let's take a minute and hear what he had to say about it.
Well, the bill came from a concern in my district at an assisted living home where some of the residents were required or going to be required to pay a penalty of $150 a month if they bought their prescription from a local pharmacist rather than through the vendor or through the vendor that was supplied through the assisted living home. So, we looked at the laws. There was really nothing to protect the patients or the people living in the home, and so we decided that we probably need to do something in the statutes that would address this issue. So basically the bill addresses that one issue. It's a right of an assisted living person to choose not only a prescription place where they get that, but other medical needs as well.
Is this a large problem in the state now?
Well, it has been in my part of the state, and I understand other parts of the state as well, but particularly in my district area, Elk City, Weatherford, and Clinton, it's been a major issue because most of the people who live, the seniors who live in these homes, only have one option, or maybe at the most two in their community. And so when they sell their home, they take their life savings, if you will. Those assisted living homes, they charge so much a month, and it's not paid for by Medicaid or any other federal source. It's paid by the individual. So many times they've sold their home and their belongings to move into the assisted living establishment, and then so they really don't have any choice. And so when maybe they've been doing business with a pharmacy for 40 years, and then they're told, hey, you can't do that. If you do, you're going to have to pay a $150 penalty. That just doesn't seem right to me. So this is all about fairness, in my opinion. The fee is absolutely exorbitant, and I think it's unfair to charge that to the assisted living seniors.
And what kind of feedback are you getting about the bill? I know the bill is now in the Senate. What kind of feedback are you hearing from other legislators?
Well, I've been hearing some positive feedback so far. There were some questions about the bill when it passed on the floor, but I think it passed 88-6 or something like that. It goes to the Senate now, and Senator Ivester is our senator from our district, and he's going to be carrying the bill in the Senate. But I've had favorable response. Now, I will tell you, the nursing home or the assisted living homes are concerned about it because they believe that they have certain liabilities and obligations that they need to provide to their to the people who live there, and so they're concerned about it, and they feel like that it's unjustified. But I just think it's not right, and so the bill is out there, it's in the Senate, and so that's kind of where we're at right now.
Dusty, could you give us a brief update about House Bill 2401? That's the grandparenting bill by Representative Rousselot?
That's right, Craig. House Bill 2401 is another one of AARP Oklahoma's priority bills for the 2012 legislative session. That bill passed the House of Representatives overwhelmingly by a vote of 90-0 last week, and it is also over in the Senate waiting to be heard soon. That bill would basically allow judges to order mediation if a judge found it to be necessary or beneficial to the parties involved once grandparents petition the courts for grandparental visitation.
We talk for just a minute. Give us a brief update on Senate Bill 1430, where it's at right now.
Sure. Senate Bill 1430 we were thinking would be heard in the Senate this week. Unfortunately, it was not. So we anticipate that measure will be heard next week. We're asking all of our members to express their support for this measure as it's one of our top priorities for the legislative session. Senator Stanislavski, Republican of Tulsa, is the author of the measure, and the measure is called the Bartman Bill for Ethical Debt Collection. It would require that all debt collectors and debt collection agencies be licensed by the Department of Consumer Credit. In addition, it would also prohibit a number of harassment techniques that are often used in the collection of debts, Craig. And the measure would also bar the purchase of time-barred debts. This is a big problem.
So people need to contact their legislators and let them know that they support Senate Bill 1430.
That's right, we're asking for support.
2267, the smoking bill, passed a big hurdle this week.
Indeed it did. This has been another one of AARP Oklahoma's priorities for a couple of years, it's my understanding. We are part of a broad coalition, the Smoke Free Oklahoma Coalition, in support of this bill, which is authored by Dr. Doug Cox, a representative and a Republican from Grove. This measure, as it was introduced, would have basically ended an almost 20-year preemption at the state level that prohibits local governments in the state from enacting ordinances that are more stringent on smoking than currently provided by state statute. The measure has received considerable opposition from both the Oklahoma Restaurant Association and the more than 12 registered lobbyists who represent the tobacco industry at the state capitol. Yesterday, the bill finally received a vote on the floor. After a couple of different amendments were offered, the bill changed somewhat. Now the bill is truly purely local control. That is, that local municipalities can enact more stringent laws on smoking, but they can also enact less stringent laws on smoking. We're certainly not happy about the amendment, but I don't know that it's a deal breaker at this time. After much debate, the measure passed 57 to 30, and it will now proceed to the Senate as well.
Okay, so it's on to the Senate, so that's a little bit further than the bill got last year.
That's right, it's on to the Senate. There's a lot of rumors that there will be a considerable opposition in the Senate, but it's yet to be determined how the new amendment will affect it. I think a number of lawmakers who say that they support local control will have an uphill argument in saying that they really do support local control, and this bill provides for complete local control on smoking.
Okay, so finally we want to talk about House Bill 2582 by Representative Jeannie McDaniel. And we've been asking our members to make some emails and telephone calls on this bill this week. Can you give us a little bit of an update about what's going on with this bill?
Sure, I'd be happy to. House Bill 2582 by Representative Jeannie McDaniel, a Democrat from Tulsa, is without a doubt probably one of the most important bills that we're advocating for this session. This measure, if enacted, would basically require that all new employees working in nursing homes, assisted living centers, home health care agencies, long-term care facilities, that they be subjected to a fingerprint background check.
And you were telling me earlier that there's some interesting figures about the cost associated with this proposal?
That's right. The measure finally had a vote this last Tuesday, and unfortunately we came up a few votes short. The measure fell 48 to 44. And Representative McDaniel, we're very grateful that she captured the vote and asked that the bill be reconsidered. We were anticipating that the vote would be heard yesterday, the vote would be taken yesterday on the measure. Unfortunately, it's been laid over, and we have about 2 weeks to have it heard again. The measure entails some funding from CMS, the Center for Medicaid and Medicare Services, and there's a grant that would pay for a good portion of the fingerprint scanning that will go on. The home health entities have been very outspoken in opposition to this because they are the only ones who would see really a true increase in their fingerprinting costs. Their costs would go from $15 for a name-based background check to $19, so $4 increase. However, part of that's because home health assistants, nurse aides, what have you, currently are not searched in the sex offender and violent offender registries. We really feel like it's important to have those checked as well for these assistants.
So it's a pretty critical time this week for people to contact their members of the State House and let them know that they support House Bill 2582.
Absolutely. 2582 will most certainly be heard in the House again, if all goes well, this week, next at the latest. And Senate Bill 1430 will likely be heard this next week in the Senate. So we're asking all of our members to contact their legislators, ask them to support House Bill 2582 and Senate Bill 1430.
Okay, so finally, coming up next week, we've got our annual AARP Legislative Breakfast on Thursday.
That's right. We're kind of known for our annual legislative marquee event, and that's our legislative breakfast. I know a lot of members and assistants look forward to a good meal and meeting with many of our great volunteers from across the state. That's going to take place this Thursday, March 8th, from 8 o'clock in the morning to 9:30 a.m., and it's going to take place on the second floor of the State Capitol building in the Governor's large conference room.
So we're looking forward to seeing all the legislators and all of our great volunteers from around the state at that
Absolutely.
event. Well, Dusty, thanks for giving us a quick update again, and I want to just encourage everybody to continue to come to our YouTube channel, and we'll give you more updates as these bills move through the process, and you can find lots of content about what's happening with AARP here on the YouTube channel, and don't forget our Facebook page, and you can find us at AARP Oklahoma.